Hi, I'm Hal David Martin here at the Hip Preservation Center, Baylor University Medical Center, Dallas, Texas. I have Kara with me. We're going to demonstrate how to go through some of the key aspects with posterior hip surgery. And if you've had any type of hamstring repair or any work done in or around the sciatic nerve, these are a few of the exercises that are really critical to having a positive outcome. So I'm going to have Kara demonstrate a few of these with us. So Kara, lay back here on your back. And if she's had a posterior hip surgery on the left side, we want to start when she gets out of bed. We're going to have her take her leg at 45 degrees down low, and we're going to use the back edge of the greater trochanter to mobilize the sciatic nerve laterally. So we're going to come up here, come up 10 times and back down. And it's like scraping ice off the windshield. You can see it's to the edge because I'm lifting this side of her pelvis right here by pushing down. That's where we want to start. And then we come up. And then we come back down 10 times. So before we get out of bed in the morning and before we go to sleep at night. The next stretch we do is, let's have you sit up. And then we're going to take and we're going to cross this leg over the other leg. And then we're going to take this leg, the operative leg, and we're going to gently pull to the contralateral shoulder. And we're going to hold that for 20 seconds. And that'll take the nerve and move the nerve medially. And so we hold it that way. And then finally, the last little thing is when we set up, the one thing I want to say too is when you sit up in bed, you want to always keep that knee bent so there's no stretch. If you want to sit up with your knee straight, you got to have your legs way apart. And that's where we start with the nerve glides. So we start here because there's increased strain in the nerve if the legs aren't apart. So we want to point the toes to the wall and touch your chin to the chest. And now we're going to take the toes and point them to the ceiling, and we're going to look up to the ceiling. Now we're going to go back to the wall, and now back to the ceiling. Good. And we're going to do this 10 to 20 times, and then we're going to slowly work from an abducted position with the legs out until the point that they're in. If we have any kind of radicular complaint or pain down to the foot, we have to start back out in a more wide position. And that's really key not to get any strain within the sciatic nerve. So those three exercises have to be done twice a day, and usually for life is best because we don't want that nerve to get restuck to either the hamstring or beneath the piriformis or into any type of scar tissue. This can also help for any kind of patient that has an intra-abdominal type of entrapment phenomena associated as well. So hopefully those will help keep that nerve from getting stuck and speed you along in your rehab. And then finally, the overstretch for this area is the shoulder back and the leg over, and that'll help to kind of stretch that gently. And we want to do that only if it's non-tender, and we can stretch the tensor portion to the posterior aspect, and if we have a contraction of the medius, it's here.